question. Okay, so if you have read and understood, considering it communication skills station, kindly please begin.
Hello, I'm Dr. Kamaldin Ibrahim, the senior
welcome,
officer
Dr.
on call. I'm calling to refer a patient, a 4-year-old woman who admitted for mild diverticulitis and has been on treatment. May I confirm I'm speaking with the vascular surgeon, Mr. Mann?
Yes, doctor. I'm Dr. Mann.
Thank you, sir.
Doctor, what you told me regarding your patient? Can you summarize your patient, please?
Yes.
Your case?
Yes.
Okay, sir. My patient is a 54-year-old woman who we admitted earlier today for mild diverticulitis. At the moment, the symptoms seems to be improving following the addition of IV fluid and antibiotics. However, she suddenly developed an acute severe lower limb pain, and examination revealed that she had atrial fibrillation on electrocardiogram. Then arterial blood gas analysis that was done also revealed the patient has metabolic acidosis with hypokalemia on the electrolyte assessment. He has done arterial duplex that confirms acute limb ischemia. So on account of this, we think the patient has critical limb ischemia and will need an urgent attention.
Okay, Dr. Kamal, is it urgent, your case? You can send it tomorrow morning instead of today?
Yeah, it's very urgent because it's a critical limb ischemia. Patient could actually lose the limb if we don't send early.
Okay, Dr. Kamal. Do you need a cardiologist to review your case for BVC before transfer? Do you need the cardiologist to see your case first before you send him?
Do I need what? Come again?
Cardiologist.
The cardiologist.
Yes, we need cardiologist to review, but that will be after we have sent the patient. We need the cardiologist to review, but we need to send patient first. Maybe while he's there, the cardiologist can review.
Okay. What do you think of her presumed diagnosis of diverticulitis? Is it diverticulitis, your case? The previous diagnosis?
At the moment, we need to consider mesenteric ischemia, looking at the current diagnosis of acute limb ischemia and atrial fibrillation that this patient has. Mesenteric ischemia may be likely, probably the cause of the abdominal pain she has.
Okay. Do you want to scan the abdomen first before you send the patient?
Yes, the patient will need to scan the abdomen. However, maybe while we have referred the patient, we can be doing that. What is important now is to basically assess the limb in order to save the limb from being damaged.
As you told before regarding the previous diagnosis, could it be mesenteric ischemia?
Yes, it could be mesenteric ischemia. It's a very close differential. very close differential. The patient has actually ischemia and with diagnosis of atrial fibrillation as well. Vascular ischemia would be a likely diagnosis.
Okay, you have mentioned scanning. What if the renal function is not normal? I mean, scanning of the abdomen. If the renal is not functioning, if the renal function is not normal.
Yeah, if the renal function is not normal, that means we might not be able to do a contrast enhanced CT scan, because patient also need to benefit from abdominal CT, perhaps contrast enhanced abdominal computed tomography scan. But if the renal function is not normal, we won't be able to do that because that will worsen the renal function. Or affect the renal function.
Other option for the scan rather than CT with contrast?
Come again, please.
What are the images?
Other options, images rather than CT scan with contrast if the renal is impaired?
Yes, we can in the absence of the that we can actually do abdominal ultrasound. This could also give likely an idea of what we're probably dealing with. We could also do magnetic resonance imaging of the abdomen as well.
Okay.
But
now,
for the critical ischemia, patient has done arterial duplex ultrasound, which has actually diagnosed the acute ischemia.
Okay. For now, how you will manage your case? Management, how you will manage?
We want to manage patients using the critically ill patient protocol, CRIS protocol. Having assessed the patient is airway is patent and breathing is satisfactory. I want to cite a wide bore cannula, start fluid resuscitation, give analgesics, give antibiotics, and I want to rest the limb while I refer the patient as soon as possible. We've done a series of investigations, ECG that show the patient has atrial fibrillation. We also done arterial blood analysis that show the patient has metabolic acidosis, likely from the ischemia, and the patient has also had arterial duplex, which has confirmed the limb ischemia. And on account of this is why we are referring to the vascular surgeon to prevent the damage to the left lower limb.
Okay, Kamal. Regarding atrial fibrillation, how you will manage atrial fibrillation?
What did you say?
Atrial fibrillation.
Regarding the atrial fibrillation.
Yes. Regarding the atrial fibrillation.
Yes.
Yes, I would like to give the patient anti-arrhythmia. The digoxins can be used, and also I would like to anticoagulate this patient using low molecular weight heparin or unfractionated heparin.
Okay.
Okay. Regarding the transfer, how the dose? Yes, ma'am. Yes.
For the I can give 5,000 international units of the unfractionated heparin IV start.
Yes.
Okay. What about the transfer? What type of ambulance you will need?
We need to have here ambulance if it's possible, and of course it has to be ambulance that has
This is what are
resuscitative measures.
Yes. What does that ambulance called? What type of ambulance is that?
That's not coming to mind now. Sorry.
Okay. What would you inform to the patient's family? What would you tell them?
I would tell them that patient has sustained a sudden reduction of blood flow to the left lower limb, and this needs urgent attention because it's an emergency, and we need to urgently assess this and manage it to prevent losing the leg.
Yes. That's why you're transferring the patient?
That's why we want to
Yes.
transfer the patient to a center that has a vascular surgeon
Exactly.
who can manage this condition.
And yes, so the patient can be managed and leg can be saved. All right. Okay. Then you can send the patient.
Thank you so much, sir.
Okay, well, it's going.
Well done,
Good.
Dr. Kamal.
Thank you. Thank you so
Thank you.
much. Any feedback you want to give? Good. I just want to say, when you were explaining about the about ischemia, then you could have maybe explained little bit when you were explaining about the mesenteric ischemia. Then you could have explained little bit more that why you think it is, and when it was like you were asked about the for the consultant, that why you should not consult cardiologist, rather you should send for transfer first. Then also you could maybe expand and give little bit explanation. Otherwise it was good.
Thank you so much, ma'am.
Thank you.